Welcome. My name is Kurt Conklin, and I serve on ASHA's Professional Development Committee. Thank you for joining us today for this presentation, Hallways to Health, Health and Education Collaborating to Make a Difference. The American School Health Association, otherwise known as ASHA, is the only organization that addresses multiple disciplines in school health and that is devoted solely to school health. Our membership of approximately 800 individuals represents school health as administrators, counselors, dietitians, nutritionists, health educators, physical educators, psychologists, school health coordinators, school nurses, school physicians, and social workers. We're the proud publishers of the Journal of School Health, a premier journal in the area of school and adolescent health. Members of ASHA can elect to receive a hard copy or electronic copy of the journal. Our membership fee is inexpensive and provides you access to the journal and also to our bi-monthly e-newsletter, School Health Action, as well as free continuing education hours through webinars such as today's presentation. If you haven't already, please consider joining, volunteering, and becoming a member of the ASHA community. Visit us at ashaweb.org to learn more. As I mentioned, the continuing education credit for today's webinar is free for all members. If you are a non-member and you would like to receive CE credit for this webinar, we require a payment of $30. After the webinar, you can receive 1.0 Category 1 CECH for MCHES and CHES, 1.0 CNE hour for nurses, 1.0 CPEU for RD and DTRs, or a certificate of attendance based on 70% or more participation today. Participation is measured by the amount of time the webinar remains active on your screen. And please join us October 9th through 11th for the 88th Annual School Health Conference in Portland, Oregon. This year, we've partnered with the Oregon School-Based Health Alliance, and we hope you'll join us for what will be an invigorating and resourceful conference. And among the keynote presenters at this year's conference will be the principal and assistant principal of Milwaukie High School, where one of today's presenters, Jamie Smeland, is based. Registration for the conference is now open, so please visit our website, ashaweb.org, to see the schedule at a glance and register. Now let's get started on today's webinar. We are delighted to have our conference partners, Oregon School-Based Health Alliance, headlining this webinar with Group Health Cooperative and Milwaukie High School Health and Wellness Center, presenting Hallways to Health, Health and Education Collaborating to Make a Difference. A poster presentation on the Hallways to Health initiative will also be at our conference in Portland. Tammy Alexander began working in the school-based healthcare arena in 1993, working as the Adolescent Health Coordinator / School-Based Health Center Coordinator for the Oregon Health Division for over 5 years. Since then, Tammy has continued her work in the field in many different capacities. She has served on both the National and State Board of Directors for SBHC and continues to provide technical assistance and training at the national, state, and local levels. Tammy currently works at the Oregon School-Based Healthcare Alliance as the Member Services Director. In this role, she oversees and supports all technical assistance and training to the field and manages the Hallways to Health program. Mandy LeBlanc is a health education specialist at Group Health based in Seattle, Washington. Currently, she is embedded in 2 middle schools thanks to the Hallways to Health grant. She has been focused on health promotion and disease prevention for the past 16 years and has been active in the wellness evolution for the past 10 years. She has established a track record of empowering people to make choices that lead to longer, healthier lives and has advised over 100 worksite wellness programs. And Jamie Smeland is new to school-based health and took on the role of Milwaukie High School's Health and Wellness Coordinator this past March. As the Hallways to Health project manager, Jamie has been delighted to engage students and school employees in improving their health and fostering a culture of wellness. Prior to Jamie's work with Hallways to Health, she worked with the School Health Center's medical sponsor, Outside In 2 innovative projects. The first, a collaborative project with a local community mental health provider to improve primary and specialty care access for individuals with chronic mental illness. The second, a project where Jamie led the clinic's efforts to improve access to cervical cancer screening for its largely homeless and transient population. She has worked in community health since 2004, advocating for immigrant and refugee families in St. Louis, Missouri, domestic and sexual violence survivors from the Latino community in Portland, Oregon, adolescents in Las Terrenas, Dominican Republic, and individuals affected by drug-resistant tuberculosis in Lima, Peru. Jamie has BA degrees in Spanish, Sociology, and International Studies from St. Louis University, where she also played Division I field hockey. We have a couple of housekeeping notes before we begin. Your phones will remain muted for the duration of this webinar. If you have questions for Tammy, Mandy, or Jamie, please type them into the questions box on your screen. So welcome, Tammy, Mandy, and Jamie. I am now going to turn it over to you.
Thank you, Kurt, and thank you everyone for joining us today. This is Tammy Alexander, and I'm from the Oregon School-Based Health Alliance. By the end of the webinar today, you will know about the Hallways to Health initiative, or sometimes refer to it as the H2H, from a national perspective and from the perspective of 2 very unique school-based approaches. In addition, we will be leaving you with some great resources, and I will start off by giving you an overall picture of H2H, and in a few minutes you'll have an opportunity to hear from my 2 great colleagues who are doing this work at the school and community level. About the Oregon School-Based Health Alliance. We are a nonprofit, and we are a chapter of the National School-Based Health Alliance located in DC. And our organization is a statewide organization serving as the collective voice to build a stable, effective, and accessible school-based healthcare system through the development of school-based health centers. So when I was getting this presentation ready, I thought, oh, maybe some of you don't know what school-based health centers are, so we better take just a minute to go over that. Briefly, school-based health centers exist at the intersection of education and health, and they are literally the caulk that prevents children and adolescents from falling through those cracks. They provide care, primary health care, mental health care, counseling, oral health care, family outreach, chronic illness management, just to mention a few, without any concern about the student's ability to pay, and in a location that meets students where they're at school. Although a direct link between school-based health centers and student test scores and grades can be difficult to capture, we know that the school-based health centers deliver results that matter to schools, including reducing absenteeism, tardiness, dropouts, and discipline referrals. Students have to be present and engaged in order to learn. So the Hallways to Health program, let me talk about that. It is a joint partnership between our national affiliate, School-Based Health Alliance, and Kaiser Permanente National, and also our local partner, Kaiser Permanente Northwest. It is for 2 years, and it involves 5 states, Maryland, Georgia, California, Washington, and Oregon, and I oversee the Washington and Oregon initiative. And H2H is focused in 3 primary areas to see how school-based health centers can work with their schools to make a difference in obesity prevention, social-emotional wellness, and staff wellness. So why should we be concerned about obesity? It's probably not a surprise to most of you that the U.S. is the most obese nation in the industrialized world, and in the past 30 years, the obesity rate for children has more than doubled, and for adolescents, it has more than quadrupled. And 1/3 of our children and youth are overweight or obese. You know, the short-term effects of obesity, kids that are overweight and obese are at greater risk for bone and joint problems, sleep apnea, becoming pre-diabetic, and of course all the social and emotional problems such as stigmatization, poor self-esteem, and being bullied. Some of the long-term effects for children and adolescents who are obese, they're more than likely to become obese adults and are therefore at risk of the adult health problems such as heart disease, type 2 diabetes, stroke, several types of cancer, and osteoarthritis. One study showed that children who became obese as early as age 2 were more likely to be obese as adults. And in fact, obese children between the age of 10 to 13 are 80% more likely to become obese adults. Overweight and obesity are associated with increased risk for many types of cancers, including breast, colon, endometrium, esophagus, kidney, pancreas, thyroid, ovarian, multiple myeloma, Hodgkin's lymphoma. So we really need to do more to prevent or intervene in habits that contribute to obesity. Childhood is a critical period for the development of healthy behaviors and habits that are frequently continued into adulthood. The second focus area is social emotional wellness, and children need to be ready and able to learn in schools. This list that you're looking at now is a representation of the challenges our youth face today and ones that impact their ability to succeed in school and in life. Mental health and substance use disorders among children or youth are major threats to the health and well-being of our younger populations, which often carry over into adulthood also. And the cost of treatment for mental health and addictive disorders, which create an enormous burden on the affected individuals, their families, and society, have really stimulated an increasing interest in prevention practices that can impede the onset or reduce the severity of the disorders. School-based health centers are a piece of that solution to addressing the social and emotional wellness aspects of our youth and children. Staff wellness, well, you know, at our schools, it's more than just teachers. We have our administrators, our support staff, our nurses, our counselors, our psychologists, our social workers, and many of those that Kurt mentioned in his introduction. Bus drivers, food service workers, maintenance staff, they form one of the most valuable workforces in the United States because they nurture and substantially shape each and every generation of children. And it's important to invest in the wellness of our staff. It will pay off in healthier, more productive, and successful staff and school environments. The staff in schools are just like the rest of the adult population. They have choices and behaviors that contribute to their illness and their loss of productivity. You can see some of the major ones listed on the slide. And in addition, it's very interesting that our teachers in the United States, the new ones coming into the profession, 1/3 of those new teachers will leave the profession during their first 3 years, and almost half of those will leave before 5 years. And that's from a study done by the American School Board Journal in 2005. So the good news is, though, it's been found that schools with employee wellness programs that are highly developed attract new employees and earn the loyalty of current employees. That is really something to consider when thinking about the why of staff wellness. So on the next slide is just some of the brief, it's a list of some of the benefits of a school employee wellness program. I mean, who wouldn't want improved employee morale or increased productivity and healthy role models for students? This is why we are focusing on employee wellness in the H2H program. Next slide. Okay, so I love this slide. I think it really brings it home for many of us. Health is primarily driven by our own personal behaviors, as you look at the blue wheel in the slide. So how can we begin to bring positive change to students and staff where they spend the majority of their time and help them develop those behaviors which contribute to positive health and educational outcomes? That's what this H2H initiative is all about. And at the same time, if you look at the little wheel, the little light blue wheel that turns the big wheel, it's the environment that we live in and the surrounding social factors that have a very powerful influence on our behavior also. These two wheels are things we can influence and can change, and that's what we're looking at in the H2H initiative. So the next slide, I'm just going to talk very briefly about this, and you could look this up if you want more information on it, but the Institute of Medicine recent report of Accelerating Progress in Obesity Prevention identified schools as the heart of health. That's why Kaiser Permanente National and School-Based Health Alliance have been making this partnership such a priority. By working together, we can continue to create schools that have a culture of health that encourages the students, the staff, and the teachers to make their healthy lifestyle changes. So school-based health centers just happen to be the vehicle that Kaiser has decided to use for this initiative. They cannot do it all by themselves. They are just a part of the fabric in the school community environment, but they can be catalysts for change. They can be great champions to bring people together. They can be experts in many types of resources, and they can be the convener that says, come on together, let's see what the problems are, let's see what the solutions are. So in the H2H initiative, we really want to try to move the needle in the 3 focus areas of obesity prevention, social emotional wellness, and staff wellness. In other words, in this 2-year period, what improvements can be made to implement possible changes in policies and procedures, systems, and the environment affecting the 3 focus areas. For example, maybe there needs to be changes in the policies and procedures between the school-based health center and the school that allows for students to be out of class more often to participate in, say, a focus prevention activity or an obesity support group. Or from a systems approach, could the school allow for physical activity, say, in every 4th period class 3 times a week, making that an integrated approach within all the classrooms? And the school-based health centers could be that resource that provides those activities. Environmentally, could maybe the vending machines be made healthier, the student store more responsive to the kids' requests for healthier options? These are the 3 areas that we're trying to change, and each participating site, they get to look at their challenges and their opportunities, and based upon the relationship and the landscape they work in, they get to decide to make an improvement plan to try to move the needle in obesity prevention, social emotional wellness, and staff wellness. So just very briefly, in Oregon we have 4 sites. On the next slide you'll see the 4 sites listed. Milwaukie High School, who will be presenting shortly. Merlo Station High School, which is actually 2 schools in one, and it's a very unique situation. Century High School, who's actually funded by our local Kaiser partners, and Washington Middle School in Seattle. And I'm really excited for you to hear more about the middle school approach and the Milwaukie High School approach. And so I'm going to turn it over to Mandy from Washington Middle School.
Thank you, Tammy. This is Mandy LeBlanc, and yes, I'm based in Seattle, working at a middle school, thanks to Kaiser as well as Group Health. And so I'll jump right in and just let you know that we are following those goals. We can go to the next slide. With obesity, I've broken them down into 4 goals because obesity prevention, obesity treatment, social and emotional health, and then school staff wellness. So Washington Middle School is a racially diverse school with about 1,067 students. 53% are on free and reduced price meals. 66% utilize the Group Health Wellness Center, meaning that their parents have signed them up. We have a school-based health center that includes a nurse practitioner and a mental health specialist. And then we have a collaborative team of school counselors that have been supporting our efforts as well. With obesity prevention, our focus is to provide health promotion materials via stall news, where we literally put a monthly newsletter up in the bathroom stalls, as well as decision point messaging in the cafeteria that reminds the students to eat breakfast, it being the most important meal of the day, as well as making healthier lunch choices at least once a week. So in Seattle, we are fortunate to have healthy options in the school cafeteria. However, based on supply and demand, it's much easier to hand out the pizza or the not so healthy options. So the students have to ask for either a deli lunch sandwich or salad. So we're encouraging them to change the supply and the demand by getting the students to ask for those meals, and they are the same price. Then we've started a Get Outside group. We call it the Go group, and we get the students to go after they have lunch. So we give them 10 minutes to eat their lunch and then 20 minutes to get outside and play. So they can either walk a lap around the track, or they can play Frisbee or hula hoop or do something that gets them to be active. And then if they join us a certain amount of times, each time we give them a little bead, and when they have 3 beads, they can turn those in for a very small prize, such as this year we used EOS lip balm, which is in the shape of an egg. They were excited about that. Then we've developed a school wellness action team, which we call SWAT, that helps us ensure that everything that we're designing is for the students and by the students. With obesity treatment, I work with up to 20 students that are either overweight or obese that have been targeted by either the school nurse, the nurse practitioner, the school counselors, or occasionally a teacher will come by and give us the name of a student that may be a good fit. The nurse practitioner then brings them into the office and has a discussion with them to determine their readiness for change, and also tells them about the incentives that they can earn by participating in the program. So I think it's a combination of readiness to change and the incentives that are offered. And again, those are the EOS lip balm. We use activity trackers that we use Misfit Shines. We selected those because they work on a watch battery so that the students don't have to charge it. But that allows us to track their physical activity as well as their sleep. And then once they've selected the program, we include them in one-on-one sessions that are, we take them out of class for 5 to 10 minutes per week. And then we also allow them to join our cooking classes and our physical activity classes. And we are getting families engaged by making, sending home messaging that encourages them to make healthier choices. So little things like switching from white bread to whole wheat bread, those types of simple messages that just start to change the family culture in ways that don't affect them too much as far as their pocketbooks. Or we also don't ask them to make major changes every week. Then we send out a one-year survey, and we are remeasuring height, weight, BMI. And we're starting to see that we're making some changes, but we feel very fortunate that we have 2 years to do this, because essentially it took 1 year to design the game plan, and we started launching that, and we expect some positive results in the year 2 as well. Then for next year, we're also asking each student to recruit one friend next fall to get involved in the obesity treatment program. And we're also tracking the Obesity Prevention Wellness Task Force for our school district to see what they're suggesting and how we can affect change. And next year we'll be creating a brief movie about getting students to making healthier changes in a way that feels cool to the students. When it comes to social and emotional health, it seems to be the biggest thing is being bullied. And so there are many reasons that students are bullied. We know that. Sometimes it's if you're overweight or obese, if you do anything that steps out from the normal, whatever normal is in your school culture, students tend to get bullied. So after reviewing many different programs, we found that we wanted to reward students for making choices where students go out of their way to be kind to one another. And so we did a little bit of messaging about anti-bullying, but really it's more pro-kindness. And so when they're kind to themselves using our wellness program, if they're kind to the earth or if they're kind to another person, they earn a bracelet. And upon earning 3 bracelets, they earn an incentive. Something similar to that lip balm or something small that just, we found that students don't need big prizes. They just need little small incentives along the way. And in 1 week, we piloted a kindness week. We trained 40 students to become kindness ambassadors by having a speaker that just talked about what it means to be kind to yourself before you can be kind to others, and why people should go out of their way to be kind to others. And then during one lunch period, we gave out 400 bracelets to, we have about 1,067 students, for taking a kindness pledge or completing a random act of kindness. And then we are working on a curriculum that promotes healthy relationships as well. And we'll break those out into working with males and females. So we're looking forward to that for next year. As far as staff wellness goes, there was a staff wellness program in place, but it was only offered between our midwinter break and our spring break. So this year we're going to offer a complimentary year-round, as far as the school year goes, Wellness Wednesday program, where we send out the email every Wednesday. We will provide a health tip, a question for comprehension of that health tip, and then a room for them to journal what their proposed action is with a suggested action. And they'll have 1 week to complete that, so it should take about 5 minutes. And then based on what their goal is, it could take an hour or 2 to work on that goal. And for those people, the school staff that complete the survey 75% or more of the time, they'll earn an incentive that we're working on. So ideally, each teacher will sign up to also lead a Go group so that we have every lunch period an opportunity for the students to get outside, so that each teacher joins a Go group at least once a week and each student joins a Go group at least once a week. So far, lessons learned. That I've been surprised at how I've designed over 100 wellness programs for different companies, and I have not seen a school culture that is as busy as school staff and teachers. So I know that they're really focused on teaching to the test because they have to be, and they don't have a lot of spare time. So that's why we created a simple wellness program to kick off this fall. I've also found that students, especially middle schoolers, follow their taste buds. So they may know that the hot Cheetos are not exactly healthy, but they just can't resist the taste of it. So I feel like that's one of our biggest obstacles. And there's a lot that we can do to make sure that our school culture is healthy as far as the foods that they can select. We've gotten rid of all the vending machines. But still within walking distance, there are opportunities for them to get those hot Cheetos and the not-so-healthy snacks. Also that middle school students have a wide range of capabilities. So as I talk to 20 different students, I have to scale up or scale down the maturity level based on where they are, and so meeting them where they're at based on their maturity. And I'll let you read the others. But going on to partnerships. These are the list of partners that we've been able to work with. We feel very fortunate to have each of these as a resource. I would like to do a quick shout out that the Seattle Seahawks won the Super Bowl, and so having some Frisbees that we were able to hand out from the Seahawks really made a big difference in the Go groups. And of course all of our partners, including Kaiser, School-Based Health, we appreciate all of those. And that's it. I've provided my email address, LeBlanc, L-E-B-L-A-N-C, .a@ghc.org, which stands for Group Health Cooperative. In case you have any questions, I'd be happy to elaborate more on what we've discussed today. Thank you. I think I will now hand it over to Jamie.
Thank you, Mandy. So my name is Jamie Smeland, and I am the Hallways to Health Program Coordinator at Milwaukie High School with our Health and Wellness Center. Milwaukie is a small city just south of Portland, Oregon, and our high school has about 1,300 students, around 1,000 of them that participate in the regular high school curriculum, and then there are about 300 that participate in a special arts-focused curriculum as a part of the Milwaukie Academy of Arts. And all of those students form our student population. It's about 70% free and reduced lunch here, and our school-based health center has been going on for about 5 years. Started out as a medical mobile clinic, so a big RV that would come over to the school, and then we eventually were able to community organize and get a beautiful school-based health center where we now have a full-time nurse practitioner, behavioral health specialist, and medical assistant, and we also have a dental hygienist who comes once a week to do cleanings. And so, you know, for us with the Hallways to Health grant, we were just so grateful to be offered this funding opportunity to create some more staffing and time to work on the really public health aspects of being a school-based health center. And while both the School-Based Health Center and Milwaukie High School were doing excellent work prior to Hallways to Health, you could tell that there needed to be a little bit more integration. We noted this last fall, my team did, when there was a school assembly and we weren't really invited to follow up. It was kind of around social and emotional health, and we didn't know about it until the day before. And at least at our school, there's lots of community resources, but sometimes teachers aren't aware of all of them, students aren't aware, and so this is really helping us to better integrate our services with the high school. And you know, some of our milestones this year for obesity prevention and treatment, so those folks that you saw bowling there and headed to the Capitol are Youth Advisory Council students. They completed health literacy presentations in classrooms. They helped us to host that booth there at the Milwaukie Cares Carnival, where we had over 200 students, staff, and families visit, and again provided information about free physical fitness opportunities for the summer, free school lunch programs throughout the area for the summer additionally. And then at the senior prom this past year, our Health and Wellness Center staff hosted photo booths, and then we had students come pick up the photos both from the health center, and we went to the senior breakfast and provided some health literacy about how to have health insurance upon graduation and making healthy living choices moving forward. And we have a school-based health center advisory council, which provides oversight for the school-based health center as well as a strategic kind of group for brainstorming around health promotion and healthy activities. And we'd like to use that group to springboard to create a health and wellness committee that's really centered in the school. That's one of our big goals for next year. And so again, promoting the Health and Wellness Center at various events, as you saw there. We also have a middle school that is just down the road, and students are able to come to our health center from that middle school. So we did some tabling there, and then we did a lot of networking with key players at the school, the health teachers, PE teachers, principal, community nutritionists, and other groups that we might like to bring in to partner with for cooking classes, etc., this upcoming year. And then as we look at social and emotional health, that depression prevention group was found to be effective, and we'll have a quote later from a student, and then ongoing behavioral health support and from our behavioral health counselor. For school employee wellness, this past fall we hosted a staff massage event. We had professional massage therapists come in to offer brief sessions for staff. We had a staff wellness breakfast and health fair, during which staff set small goals that they could accomplish by the end of the school year. We had, again, around 40 staff that participated in that, which was fantastic, and then a staff walking group that is currently led by staff. We have a staff member who's taken the lead to plan different hikes and small walks that can be done right from the school once a week. And some of the feedback that I mentioned, one of our student participants in the depression prevention group said, this group is the only thing I have to look forward to all week. And one of the teachers, in addition, as you can see here, who set a goal, shared with us that they had met with a dietitian. They were going to see their primary care physician to see what they needed to do to lower their cholesterol. They appreciated the program's presence and had seen positive changes in both students and staff. So really great to receive that feedback. And just from one of our youth advisory council members, thanks for all of the fun. So it's great to have youth that are helping to guide the activities that we do and giving us feedback about how we operate as a school-based health center. We also had students who made a promotional video for the health center. So that was all produced by students and distributed during the school day. Some of our challenges and lessons learned is that staff turnover can really affect your ability to go outside of your day-to-day work to do larger public health efforts, such as the purpose of this grant to really touch the entire student body. We lost our key medical provider, as well as the person in my position transitioned out midway through the year, so I was just there kind of for the last quarter. And we saw that leadership is really important, especially if you want to have improvement in your clinical data. So we're very excited to start this year fresh with a new provider and to have some very specific, clear clinical goals for obesity prevention. And then coming in late into the school year, the school calendar is really sacred. You have to plan well in advance to be able to initiate perhaps an after-school activity, to be able to get into the school assembly, to speak. And so I think that we are really, again, well organized for this upcoming school year and looking forward to being a constant presence at every big school event, whether it's the student staff basketball game, a football game, the Relay for Life event. Being able to bring health and wellness into the fabric of the events already at the school are one way that we'll be able to make this health and wellness work sustainable after this grant ends. And then the after-school program coordinator, we've had a little bit of kind of some mixed reception, I think, to our work. And so we're just really trying to take time to build relationships and recognize that at a school there's a lot of history and tradition, and so that we have to be able to prove ourselves that we're important for people to get to know us. And then, just working with students and trying to be flexible and also consistent in your expectations for their participation. And our future plans, we have many of them, and we're actually going to have a visioning retreat where we're inviting members of that advisory council as well as students, parents, key staff. We're going to bring in and we're going to help, or we're going to enlist their help in creating a strategic plan for next year. And we're hoping that some of these things will come out of it, but we really want to still see what vision they may have for us as well. So we're looking at an annual physical fitness competition. We are going to be hosting a mental health first aid training for staff, where staff will be able to receive training about how to identify mental health issues and to know where to go, how to refer to our health center, how to know when a student may need a little more support, as well as some goal-setting programs, kind of peer-to-peer mentorship in terms of that goal setting for both students and staff. And then we are going to develop a consistent system of presentations by our medical provider for parents, students, and staff. Again, we're really trying to put building blocks into place that will be there sustained after the termination of this grant. And then we've got one more slide with a few more future plans. And so we would like to have a way for our Youth Advisory Council members, students, to evaluate every material that we distribute here at the Health and Wellness Center, from the confidentiality policies that we use, perhaps a flyer, a poster. We want students to be involved in advising us on the production of those materials to make sure that they speak to teens, that they can understand them, and that they're learning more about the health system. We'd also like to implement surveys in all the health classes so that we can get some data from students about if their health class was effective, what they've learned, where they might need more health and wellness support. And in addition, to be able to offer regular after-school classes focused on health and wellness. We do that already. We have partnered with the after-school coordinator to have physical fitness focused classes after school, and we'd like to include things such as a cooking class and a class about domestic and sexual violence prevention. And then we just want to make sure that we have regularly structured meetings and times to reflect with school administrators, with that school health and wellness committee that we hope to form. We'd love to have a subcommittee of that would be focused around school employee wellness. And so again, making time early in the school year to be able to meet with key players. Thank you all so much for taking the time to listen to some of our work here at Milwaukie High School. I'd encourage you to contact us if you have any further questions about what we've done this year.
Okay, I want to thank Tammy, Mandy, and Jamie for a great presentation on Hallways to Health. If you have any questions, please type them in the questions box that's on your screen. And we do have a couple of questions already. Is there a fee to sign up for the Wellness Center?
So Mandy or Jamie, that would be one for you.
Sure, I can jump in first. There is no fee, and there's no fee for service.
Yep, and just to add similarly here at Milwaukie High School, for students everything is free signing up. Getting any sort of treatment here at the health center is free. If the student does have health insurance, we will bill that insurance if the student allows us. If they would prefer it to be a confidential visit, then we will not bill their private insurance, or their private insurance, or their parent would receive a letter that they had attended from their insurance company. And so we do bill, but only when the student provides us with permission to do that. But again, everything is free to the student, never a copay, nothing like that.
And a follow-up to that, do families get to sign up for free as well?
This is Mandy, and families are not currently included in the program. However, we are doing outreach to the families we'll probably have a parent night to let them know what we're working on. But no, families cannot attend the school-based health center.
Okay, do you encounter... I'm sorry, go ahead.
Oh, sorry, this is Jamie from Milwaukie. Just wanted to chime in there that for our health center, similarly, parents are not able to come to the health center. We are open to the feeder middle school, so frequently we have high school students that might have a younger sibling. We're also open to any homeless student in our school district of any age. So sometimes we do have siblings who attend the health center, but not for adults at this time.
So this is Tammy. I just wanted to add from a broader perspective. So school-based health centers are an access model, and so all youth and students, and generally they're of the school district or feeder schools, can be seen at the school-based health center without charge. So that being said, that's the school-based health center itself. Now the Hallways to Health program is being led out of the school-based health center. And there are some sites that will be holding activities that are more community-based or family-based. So, for example, a school might be doing a nutrition or cooking class in the evening, and they're getting parent involvement. And oftentimes they try to get community partners to support that financially, or there may be a minimal cost for the families to participate. Some other models, some other sites are using exercise classes after school that are for the staff, and they're looking at how can they invite other community or family members, and there would be potentially a nominal fee for them to participate in H2H kind of activities. So that question sort of needs to be teased out a little bit. You know, who can come to the school-based health center and who's participating in the H2H, the Hallways to Health activities. So they can be answered a little differently, I guess.
Okay, do you encounter much pushback from students or parents when students are selected for the obesity treatment?
Mandy, you want to talk about some of your participants?
Sure. To date, nobody has really given us pushback. I think that students are aware that they're overweight or obese, and the incentives really make up for any self-esteem or any issues that get them to not be excited. We originally thought about doing group work, and it was decided and suggested that we do these sessions one-on-one just because students may not be excited about being in the group at first. And then as they develop a relationship with us, I basically serve as a health coach. And I think that they start to look forward to seeing me, especially in middle school. They really enjoy the one-on-one attention. And also, just to highlight, our goal with students who are overweight, we wanted to just have them maintain their weight while they grow. And then for those that are obese, we want them to lose a little bit gradually, but we're not looking for any rapid weight loss.
Okay, this person is asking, did I miss the grant award amount to plan and implement this great initiative?
So this initiative is a 2-year initiative, and the sites get around $45,000. That's right, Mandy and Jamie, for your sites a year. So that's equivalent to basically hiring a part-time person, usually a health educator. And the sustainability factor we're working on in year 2 to see how this can be continued, because the buy-in from the school and the school-based health centers and the medical sponsors of the school-based health centers, they're starting to see the difference that this is making in not only individuals, but it's affecting the climate. So they're just in that planning stages for year 2, and as they approach, you know, looking at the next year, they're trying to see ways that they can find that support from the community, from the medical sponsor, and from the school to continue this work.
Great. You mentioned, Tammy, in the beginning of the webinar that it's difficult to capture data linking academic success to school-based health centers. Has the School-Based Health Alliance thought of ways that we can better capture that data?
They're working on that. There are actually some really good resources on their website about academic success and how it relates to having a school-based health center in the school. And so you can go to, I think it'll be on the resource page, their website will be on the resource page. It's easier to see than to say. And you can go there and just Google academic success, and you will see that there have been some studies that have looked at schools with or without a school-based health center, and absenteeism rates, discipline referral rates, looking at children with asthma and being able to be in school because they're getting appropriate prevention and treatment while they're in school for their asthma. So there are some ways to capture that, and we are looking at further ways, and there are some research projects that are in the chute right now that are dealing with that.
Okay, which comes first with respect to the approval of school-based health centers implementation, the state approval or the district approval?
Well, from Oregon's standpoint, this is Tammy, there's many ways to become a school-based health center. If you're applying for funding, which comes from the general funds of our state legislature, and that's made available occasionally for new sites to do it, there's a community engagement process that they must go through to get the school board's approval. Without that, without the community behind it, school-based health centers would have a very large hill to climb and would not necessarily be very successful. So from experience, it's best to get the school-based health, the school board approval first. And from there, then they go to making arrangements for medical sponsors and getting all the agreements in place that will facilitate a health entity and an education entity working together.
Okay, great. In terms of school staff and school staff wellness, were there improvements for Mandy or Jamie?
This is Mandy. I can take it first and then hand it over to Jamie. This is the first year we were basically designing the school staff wellness program. So we were doing health promotion, but we will launch the school staff wellness program in October. And yes, I expect favorable results.
Yeah, and over at Milwaukie High School, you know, we did see, we had about 40 staff that set health and wellness goals, and then I think we had around 17 staff that replied back when I did a check-in with them to see how the goal had gone and if they needed any further support. And 17 responded that it had gone positively, that they had accomplished whatever that goal was. And again, these were simple goals: drink more water, be able to, you know, walk every day after school. Some people had more specific goals around things they want to do, try new foods, such as, you know, adding flaxseed to my diet, etc. And so we did see some staff that really engaged with their goals and did accomplish that, as well as some other staff that didn't respond to the check-in, or staff that said, oh, not quite, like wasn't able to do that at the end of the school year. And so I think that what we've mostly seen for our staff, actually since reaching out to them through the health fair and some emails and that after-school walking group, is that staff are more aware of our school-based health center in general and more engaged. So staff have invited us to be a part of events. Staff are considering us now one of the key players here at the school in a way that I didn't think they were previously. So it's really been an added bonus of focusing on the staff, is now they know who we are and they're excited to work with us.
Okay, this question is for Tammy. Is there a plan to expand Hallways to Health to more states?
I hope so. So the powers that be are in discussion. We're hoping to see what that looks like in the next couple months. It certainly is, similar programs are sort of taking place in other pockets of the United States that we're learning about, people doing some similar work. So it would be, I'm hoping the momentum that this is just not a two-year initiative, that this is something that is altering the course of how school-based health centers work within their school and their school community, and that we're really taking the silos and merging them. And so we're all very hopeful that there will be round two, or maybe another initiative that will continue this work.
Okay, in terms of behavior among students, what was measured? Discipline reports or number of suspensions?
So this, Tammy, there are some studies out there, and if people want to write specifically to me about that, I can point you in the right direction for some of those studies that have been done that show the decrease in referrals to suspension. And then there are some programs that the school-based health center is part of. In lieu of suspension, the students can participate in a group or a program that the school-based health center helps facilitate. And so there's different approaches out there, and there are some studies out there. So I'd be happy to, if someone literally wants to write me with some more specificity to that, I'll point them in the right direction.
Great. How long have school-based health centers been around? Is there a noticeable growth rate?
So school-based health centers have been around for over 30 years. They started initially in the elementary school level, and in Oregon, we just have to do it different. We started in the high school level because it was initially seen as a teen pregnancy prevention model, which it really wasn't, because they wouldn't let us do any full reproductive health services. So they realized it was an access model and they could really look at the whole child. And so they have been growing. I think nationally it's over 2,000 now. Most states have school-based health centers, or school wellness centers they're often referred to. And states are recognizing the model of care and the success that they can bring, especially in the new landscape of affordable care and how school-based health centers can actually help health systems meet their metrics. And so it's a model that's been around for a long time, been doing great work, and I think it's only going to continue to be recognized for its ability to provide very holistic, appropriate care to kids where they're at, when they need it, and by providers that are skilled in that. So I see the model, just depends on funding, but the model could very possibly grow in this new landscape of healthcare reform.
Okay, if you have any more questions, just type them into the questions box. How many states have school-based health centers? How can I find out about my state?
You can go to the national website. It's www.sbh4all.org. It'll be on the resource slide, and there is the census that will direct you to a map of the United States. And I think that all but like 1 or 2 states have school-based health centers or school wellness centers. Oregon, we have 69 in Oregon, for example. In California, it's quite a bit more. In Washington, they're growing. So contact the National SBHA, School-Based Health Alliance, and they'll be able to point you to the people that in your state know about school-based health centers.
Okay, great. I just want to thank Tammy, Jamie, and Mandy again for a great presentation. If you have any questions, their contact information is up on the screen. We don't have any more questions for you all right now, so this concludes the webinar. Everyone have a great day.
Thank you.